I had earlier on introduced you to our topic, which is uterine fibroids, and I had taken you as far as discussing how they come and then the risk factors associated with them. So today we are talking about the signs and symptoms, because we would want our sisters, our mothers, to actually be vigilant. When they note some of these symptoms, they can actually quickly seek for medical advice or assistance or examination. But the signs and symptoms that I'm going to talk about, some of them may happen due to other medical conditions, not necessarily due to fibroids. So it is important that when you note some of these signs and symptoms, you actually go for assessment or examination. One is heavy menstrual flow. Not always that when you get heavy menstrual flow, it's a sign that you have uterine fibroids, but it can be a sign. Because uterine fibroids receive a lot of blood. So usually when you get your periods, the blood flow or the menstrual flow is heavier than before. So it is important to note the changes. Two is the menstrual flow, or what we call in between cycle menstrual flow. For example, when you finish your menstrual cycle or flow actually today, and then you expect the next one is at a certain date within the coming month, but then in between there you get another flow, it can be a sign, not necessarily that you have uterine fibroids, but it can be a sign. The other thing that we have to look at is the back pains, especially those periodic back pains that sometimes they respond to painkillers, but then they come back. It can be a sign, so don't ignore it. The other sign is the pelvic pain. Sometimes you experience those periodic pelvic pains. The pelvis is this, as you're moving down in the lower abdomen, but down, that cavity is called the pelvis. So sometimes you may actually be experiencing those or sometimes lower abdominal pain, as we usually call it. It can actually be a sign to tell you that you might be having uterine fibroids. The other sign, which is very common, is difficulties in conceiving, especially with uterine fibroids that are inside, that are within the space of the uterus, because they sometimes occupy the space where the fetus would implant. That can be a sign. Frequent fatigue, those periodic episodes of fatigue, even when you've not done really much, it can be a sign, so you can go and seek for further examination. The other sign that we can talk about is actually headache. Sometimes we get headache. Not every headache is due to to uterine fibroids, but sometimes because these fibroids receive a lot of blood, they tend to draw a lot of blood from the upper parts of the body into the uterus. So this sometimes causes mild to moderate anemia, and so you can get those on and off headaches. The other sign that we can talk about, I've talked about abdominal distension, especially for uterine fibroids that grow on the upper part of the uterus. They tend to cause abdominal distension, like the abdomen grows forward and makes you feel or think you are actually pregnant. So that brings me to the next sign, and the sign is a feeling as though someone is pregnant. Remember, these uterine fibroids are as a result of the interplay of hormones, estrogen and progesterone. So sometimes you get a feeling as though you are actually pregnant. Thank you so much.